I don't know about you, but as a physician and surgeon, I've had about all the enjoyment I can stand listening to healthcare according to Obama. The pure politics applied to this issue instead of rational debate is reprehensible. Healthcare affects every American in some of life's most intimate and important moments. Evidently, we not only need the government to spend us out of bankruptcy, we need politicians to protect our children from unnecessary tonsillectomies. No pacemaker for grandpa, painkillers will do just fine. The President's statements regarding healthcare and doctors reveal three very important points, but probably not the ones he intended. First, he is uninformed about even the basics of our healthcare system. Pediatricians and generalists do not perform tonsillectomies. They refer patients who have failed medical management to ear, nose, and throat surgeons who do. His suggestion that physicians prescribe painkillers instead of more expensive but effective treatments for painless conditions like heart rhythm problems is not only ethically and morally corrupt, it is against the law. Second, he reveals an underlying disrespect and contempt for physicians. In effect, he charged that doctors are ruthless mercenaries. That may be an apt characterization of the political culture in which he operates, but it is time to call a lie a lie. The vast majority of physicians and surgeons are hardworking, dedicated professionals with the patient's best interest at heart. We bring years of rigorous study, challenging training, highly technical skills, and yes, guts with us each time we assume care for a patient in the operating room. Multiply that by 10 when we are caring for a child, which leads me to point 3. It would appear that the President views doctors, patients, and parents, much as he does the policemen in Cambridge, Massachusetts, as stupid. He suggests we are ill-equipped to make our own healthcare decisions and need the government to guide us through them. Could this be the same government that has bankrupted Medicare and Medicaid, the two government-run healthcare entities they currently control? I have a different view after more than 20 years of practice in the real world of medicine and surgery. It should be obvious by now that politicians in Washington do not have the knowledge or the proper motivation to fix what's wrong with our healthcare system while preserving our wonderful and innovative care. Now we learn that candid discussions and opposition to government care in Congress is vigorously suppressed behind the scenes by intense pressure that's been described as bordering on extortion. This is an insult to every American, regardless of political affiliation. The threat to healthcare groups who contemplate opposition is that they will lose their seat at the bargaining table and find themselves on the menu as lunch instead. This has been documented in several places as well as the Wall Street Journal. So what is the answer? There are problems with the system, and it would appear there is now widespread motivation to tackle fixing them. I truly believe that the private sector and American ingenuity hold the solutions if given the chance in a stable, non-crisis mode healthcare environment. Daily threats from Washington to nationalize the system through rushed legislation have paralyzed most parties concerned into inaction. Why not demand that Congress impose a 1-year moratorium on new healthcare legislation, including the 30 new agencies that would be created by the 2 pending bills, to allow Washington to prove to the American people they can fix Medicare and Medicaid first? The President will still be there. Meanwhile, a private sector American healthcare summit can be held with the major components of the healthcare industry participating, so we can craft workable models that can be implemented. We might even show Congress how people from many different sectors can work towards a common purpose to achieve sustainable solutions that don't add trillions of dollars to our exploding, massive federal deficit or intrude into citizens' most private affairs. Can't be done, you say? Visit usahealthalert.org to view a practical 12-point plan that addresses fixing the major areas in our healthcare system, utilizing much of the infrastructure that's already in place. It's a starting point that offers better solutions than the rationing system that federalized healthcare will become, as it has in Britain and Canada. I'll close with these thoughts. When I complete the pre-op visit with a patient before surgery, I tell them no one on the planet cares more than you and me that this operation goes well. Physicians and surgeons all across the nation express similar sentiments in words and deeds every day as they care for their patients. Do not relinquish the best advocate you will ever have for the health care you need, your physician. In the two bills currently before Congress, the politicians in Washington have clearly promised that they will decide what is indicated, cost-effective, and fair for you and your doctor, and then ration care accordingly. Act now by contacting your elected officials and tell them no thank you to government-run health care. If we, the people, can save the finest health care in the world by fixing what's wrong with the system, we will have done a mighty thing for the future of our country and for our children.